3:30 p.m. on April 16th, 2020. This is Janet Hill of the Rock Island County Health Department. We do not have prepared statements today. Rather, we'll just hear from Nita Ludwig of the Rock Island County Health Department and Ed Rivers of the Scott County Health Department, and then take your questions. We do ask that you put your questions in the chat box, and then if you have a specific question to direct to one or the other, please indicate that in the question. Okay, Nita, would you like to start us off with numbers, please? Nita, are you there?
I'm so sorry. Can you hear me now?
Yes, I can.
All right. Today, the Rock Island County Health Department is reporting 21 new COVID-19 cases, bringing the total cases in Rock Island County to 201. There are 12 patients currently in the hospital in Rock Island County.
Okay, thank you, Nita. Ed, what are Scott County's numbers?
Today, 17 cases were reported in Scott County for a total of 146.
Okay. WVIK is asking, would you please give us an update about how many people are being treated in local hospitals? Nita, you said 12, correct?
Yes, 12 currently as of today.
Okay. Ed, do you have that number?
I do not have that number in front of me, no, and we would not have information on how many were on ventilators in any case.
Okay. We don't have that number in Rock Island County either.
No, we don't have numbers of ventilators, and there was a question, and yes, it is 201 total positive cases reported to date.
Are there any other questions? The Quad City Times is asking, we regularly get questions from readers asking why we don't have a breakdown by city rather than county. Can both of you address that, please? Scott County first, please.
Yeah, our Department of Public Health provides aggregated data on a county level. They don't go any deeper because of issues of medical privacy, and the numbers get small enough that patients could possibly be identified.
Nita, for Rock Island County?
Sure. Similarly, on the Illinois Department of Public Health website, you can scroll down through the map and put in just the county or zip codes. They do go down to zip codes in Rock Island County. However, if there's 5 or fewer cases in a zip code, it will not appear for privacy reasons. But the other numbers you can see. For instance, you can tell 61201, 61265, and 61244. There are numbers listed for confirmed cases in those zip codes right now.
Okay. With all the talk of the economies opening up in both states, how fearful are you of a relapse? Nita?
Well, I agree with Governor Pritzker was just talking a little while ago that we have to be careful. We certainly don't want to see the numbers go higher and rates increase. So I think the governors of several states are getting together and kind of making determinations on how safely to do that. So I appreciate their putting the thought behind all of that.
Ed, what do you say about that?
Well, if you watched the governor's news conference today, you noted that in Lynn County, they've hit the number that required further restrictions. And as we talked about earlier in the week, the Institute for Health Metrics and Evaluation says Iowa won't hit its peak until late in the first week of May. So I think it's premature to talk about the economy in Iowa reopening, although it is true that the governors are getting together to talk about plans for when that eventuality should present itself.
We have a question about the number of recoveries in each county. Ed, is that number available in Scott County?
The Iowa Department of Public Health has added information to the map on its website that was made available earlier in the week. It had some problems and they took it back down, but now it's back up and functioning, and that information is available for each county on that website for the Iowa Department of Public Health novel coronavirus website.
Okay, thank you. Nita, are similar numbers available in Rock Island County?
We do not have tracking numbers for recoveries at this point. I know the Illinois Department of Public Health Director, Ngazi Ezike, she has talked about the state is going to be working on some recovery data, but right now we do not have any.
Okay, thank you. Will tests be expanded soon in Rock Island County after the governor said no doctor's orders are required now to get a test? Nita?
Yeah, I could be wrong, but I think he was speaking about our community health care here locally that is doing the testing. And I do believe they are still doing a telephone triage of those who are symptomatic that need a test. So they have expanded, like we talked about yesterday, I believe they expanded all the criteria for testing. So that should be more plentiful than it has been.
Okay. With all of the long-term care outbreaks in Iowa, is there anything more that retirement communities can do to protect their residents? Ed, would you speak to that, please?
Yeah, the Iowa Department of Public Health on its website has guidance for long-term care facilities that's fairly detailed, and those are the procedures that they should be following.
Okay. That is all of the current questions we have. We'll pause here. Oh, there's another one. When antibody testing begins, how will it be implemented? Ed, do you have information on that yet?
We don't have information on widespread antibody testing, but I did note that the National Institutes for Health is seeking volunteers for a 10,000-person study that they're doing related to convalescent plasma, and the University of Iowa has announced a similar program. I didn't see any numbers there, but at this point, the interest in antibody testing goes to persons who have recovered and its use in convalescent plasma.
Okay. Nita, anything to add there?
I would just note that I do believe there had been one local resident that submitted to the regional blood center, and I think the blood center could answer any questions or steer people to where they might be needed if they feel that they can meet that criteria for antibody testing.
Okay. There are no new questions at this point, so let's pause for about 30 seconds, and then after that we will conclude the media conference for today. As a reminder, we do not plan to have one on Friday. We will resume on Monday.
Hi, everybody. Can you hear me all right? It's Kirby Wynn.
Hi, Kirby.
Hi. I've been listening in. The response on antibody testing is that's fair, but I thought, well, I don't know. This certainly isn't right around the corner. You know, that there's nothing current, you know, in place or really planned. There's a lot of challenges within that idea. Now, the convalescent plasma donations with folks who've had a positive test, that's another matter, that's rolling. But general antibody testing, for those curious if I understand that question from WVIK, I just wanted to kind of, I guess chime in with a message of we're aware, but watching and have some concerns about essentially false positives within that antibody testing. that ultimately wouldn't let anyone have a lot of confidence in the results.
Okay. Thank you, Kirby.
Yeah.
So WVIK is asking, the National Institutes of Health Serology Study is asking for people to volunteer who have not been confirmed as a COVID-19 case.
Yes, I can respond a little bit to that, unless do you have more you want to say about it?
Please go ahead, Kirby.
Okay, thanks. This is what I get for looking at my phone and listening with one ear, because I am aware also of the NIH study, and we are, and that is an active referral program that is going to help us develop, help our industry, help blood providers generally develop a national database of folks who are in that boat of, well, I was pretty sick, I had these symptoms, I think maybe I had it, but Michelle, I think as you wrote from WVIK, have not been confirmed. Then we at least know people we can follow up with, kind of on an if and when the time comes where we would do that sort of antibody testing with those folks.
Okay.
And I can jump a little bit more on that and share at least back with Michelle. Others may be curious too, but is that the main purpose of the study? I don't have enough confidence really to answer. I'll check in with Dr. Katz and look up other info. My understanding of it, at least as of a meeting this morning when I was listening in, is to at least know who these contacts are. We're still at the point of just wanting to draw plasma from people who have had that positive test result, but that there's an idea that it will be helpful to know, to have this database built.
Okay. Any other questions? Okay, I believe we will wrap up for today. Again, expect to hear from us on Monday. If something comes up, watch your email on Friday, but right now we expect to be with you again on Monday. Thank you so much for your time. Goodbye.